Good afternoon and welcome, everyone. My name is Lynn Duran, and I'm the Assistant Dean of Student Affairs at the College of Public Health. Thank you so much for joining the virtual MPH Applied Practice Conference Student Highlight event. It's one of my favorites. We're so excited to have you all with us here today, including current students, faculty, preceptors, and prospective students. First, I would like to take a moment to respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the Atam and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with Native nations and indigenous communities through education, offerings, partnerships, and community service. As you may know, our Master of Public Health students from each of our campuses conduct applied practice experiences in communities around the world. The applied practice experience serves as an integral part of the MPH degree curriculum, in which our students utilize their academic knowledge in the classroom in real-world practical situations among professionals in the public health workforce. We are so profoundly grateful for the collaborations between our students, faculties, and agency preceptors, and are very proud of the contributions our MPH students have made to the field of public health. This virtual Applied Practice Experience Conference is our opportunity to showcase the breadth and depth of public health work that our MPH students have done with local, national, and global communities. Coming up next, you'll hear from our MPH presenter and learn more about their amazing experiences. After our student panel, we will provide some additional details about the conference and how to view the rest of our fantastic student presentations. Thank you. Kim?
Thank you, Lynn. Welcome, everyone. My name is Kim Barnes. I'm the Director of Student Affairs for our Phoenix campus, and I'm going to be your moderator today for the session. And today we're very excited and happy to welcome our student highlight speaker, Lauren Pizzino. Lauren is an MPH student with a concentration in Health Services Administration at the U of A, the planned graduation for this August. She holds a Bachelor of Science in Public Health, a minor in Psychology, and a certificate in Healthy Aging. For her applied practice experience, she conducted her work at the University of Arizona's Campus Health as their program evaluation and quality improvement intern. She focused on improving health system operations and boosting immunization efforts. In addition, Lauren works as a specialist at Canyon Ranch, a health and wellness resort in Tucson, Arizona, where she helps manage one of their wellness immersion programs. Lastly, Lauren is very passionate about holistic and integrative health, promoting healthy aging, health education, and managing public health programs. We're so excited to learn more about her and her project today. So today's session is meant to be a Q&A conversation with Lauren. So please, as I'm asking questions, if you have questions, feel free to raise your hand. We can call on you, and then you can unmute. You can also put questions in the chat, and we'll get through them throughout today's session. So we have until 5 o'clock with Lauren today. So really excited we have all this time with her. So I'm going to jump right in and ask Lauren to briefly describe herself and her applied practice experience. So where it was, what she did, etc.
Thank you, Kim, for that introduction. Truthfully, you hit all the points in that bio, but I'll briefly introduce myself again. So my name is Lauren Pizzino. I'm so grateful to be here today to describe my experience, both within the College of Public Health. I did my undergraduate degree in the College of Public Health and graduated in December of 2023, and also obtaining my Master's of Public Health, expected to graduate this August. Before I dive into a little bit about myself, I wanted to touch upon this panel and this highlight event. I actually participated in this event during my first semester of graduate school, which was so valuable because I didn't know what I was getting into with the applied practice experience, and there's a lot of layers, and hearing from a student firsthand was just such an amazing experience for me. So I'm incredibly grateful to be on the other side of that and to give my advice and share my experience and support others in that same way. So that's a little bit about me and how this is very near and dear to my heart. Um, as for the realm of public health, Kim touched upon, I'm very interested in healthy aging, integrative care, kind of that holistic healing side of public health. And that all ties into health education. But another love of mine that I got to express during my internship was the side of healthcare administration and management. I'm really looking at different processes to help support an organization as a whole. So I'll give a brief kind of description as to what my internship was. Kim gave a great overview. I did my internship at the University of Arizona's Campus Health. I was their program evaluation and quality improvement intern. So essentially, what I was doing throughout my internship was more operational and administrative in its role. And what I looked at was I reviewed the accreditation report that Campus Health has and undergoes. It's through the AAHC, which is the accrediting body that basically keeps Campus Health in the realm of compliance. So their report goes through regulatory processes and different domains that highlight what is non-compliant and what is compliant. So I went through, it was about over an 100-page report looking at compliance and regulatory standards for campus health. And alongside of that, and doing a program evaluation with that, I also developed a QI plan and assessment for boosting student immunization rates within their immunization clinic. So the focus areas were really on identifying gaps in different processes, both on the program evaluation side and on the quality improvement side. And then also, in turn, all of this, the change wasn't going to happen overnight. A lot of this was reviewing documentation and then creating and implementing a plan. So a lot of what I did was program implementation, creating that documentation for campus health to take forward in the future. And in part with my program evaluation for the accreditation report, I created SMART goals to help ensure that the compliance was going to be 100% in the next accreditation cycle. And then for the quality improvement assessment and method that I used was the PDSA, which is Plan, Do, Study, Act. So I followed that framework essentially for my documentation for the QI assessment within the immunization clinic. And a lot of it was, just a takeaway in total was getting to apply what I had learned in a real world setting and really learning how public health continues to improve systems and how I was able to, firsthand impact student care.
I love everything about what you just said. So first of all, we did not pay her to plug this event, although I'm super happy that she did, because yes, we love to hear from our students. We think it's super helpful for all of our audience types and members. But what I really love about what you shared in your project is that you talked about how you wanted to kind of try a different aspect than you had. So this administrative aspect was going to be new to you. And we love when our Bachelor of Science students then bridge into kind of something new, a new flavor of ice cream, if you will, to make sure you're kind of becoming well-rounded in the public health setting. As a college that goes through accreditation, I feel you on this. You can only do so much for the current cycle. And so hearing that you're helping to set up for the next accreditation cycle is really important, because we know that work continues. And the more that we can have the forethought of what needs to go in, and the PDSA model, right? Plan, Do, Study, Act. That's such a great model because it allows for revisions. It allows for that cyclical nature of the program. It isn't just we move forward in a linear fashion. And so I really like when students are able to have that experience with their projects, because you see all of the different elements. And then you see how they can move into the next cycle, right? We're not on a hamster wheel. We have to move forward. And so I really love all the things you said about your program. And interning at Campus Health is so fantastic that we love when our students are there. You get to see the higher education side of things and the public health side of things, and be part of what impacts students in the future. And so helping your cohort, et cetera. If you can tell us a little bit, how did you find your experience?
Yeah, this is a great question. And having done internships in my undergraduate degree, for those, I relied heavily on viewing any opportunities that were open in Handshake or even what was posted on the public health websites. But for my MPH degree, I took a slightly different approach. I actually found this internship through a mentor and friend who I believe is on the call, Rachel Abraham, who is a DRPH student at the College of Public Health and who works at Campus Health as their evaluation manager. So this is a shout out to Rachel. And she connected me with Dr. Solowski, their executive director, and he was looking for some additional support. Wasn't necessarily looking for an MPH intern, but I shared what I was interested in and what I was looking to get out of an internship. And he really, we both really chatted about that and saw that it would be a good fit for me to be there. So I sent my resume over, we had the discussion, and a huge takeaway from this for me is that the importance of networking and the power of connections. I probably wouldn't have done my internship at Campus Health if I didn't have Rachel as a connection. And I've been building my network now since probably the beginning of my undergraduate career to really identify people in positions that I want to be in and building kind of just, the network in total, whether that be on LinkedIn, friends, family, faculty. There's really so many levels to it, but I found my internship through networking and through a mentor.
I love the phrase, the power of connection. You hit that right on the head, because I think that's not only super valuable for your budding career as a professional, it's always going to be valuable and powerful for finding opportunities, and then powerful for being at those places and the collaboration and the things that you are able to develop. So shout out to Rachel, who's also an MPH alum and a DRPH student. And I see that Dr. Slavsky is also on the call. So thank you so much for hosting our students. And we really think that in this case, I love what you said about, you looked in a few places and you had done that with undergrad, then making that connection and then developing that relationship. It wasn't, a cold email of, hey, so-and-so connected me, can be an intern. It's the getting to know you and your skills and your interests, and then that sort of back and forth of figuring out, okay, how can the site become a place where you get to develop your skills and you get to do something beneficial for them? Because that's where that magic happens for internships, right? We want to make sure it's both for you and the site and that experiential piece. So I'm super happy to hear that. That really touches all of the things that we recommend students do. So again, this is not a paid, Lauren's not getting paid, but we probably maybe should think about it if we could, right? And so, yeah, I think that that's so fantastic that you were able to bridge those connections. How did you know Rachel?
I actually had reached out in my undergraduate career and I was nearing graduation, not necessarily knowing what I wanted to do. I knew I wanted to go into the MPH program, but I wasn't sure what emphasis and kind of what that was going to look like. So I had a faculty member, and I can't remember who, asked to have a student mentor who was who had completed their MPH. And Kim, it might have been you who had given me the connection. Well, everything's coming full circle right now, but who, yeah, it was a faculty member who gave me her information, and um, I was able to connect with her and we met over coffee, and I realized I wanted to pursue my MPH, and she told me a little bit about the health policy and management, and I kind of had my love for administration, so it was helpful to hear her side of things and also kind of understand what I wanted out of an MPH degree. But yeah, through the school.
Magic over coffee. It's my favorite thing. I love it. So that's so fantastic to hear. And yes, David, thank you for hosting our internships, our interns. We're super excited. So my next question for you is, and for those who maybe don't know, the applied practice experience, there's a pretty involved planning process to get everything, all the ducks in a row so that the internship, the APE itself, can meet all of the requirements that we need it to. So in your experience, what was the most challenging part of that process?
It's a good question. I would have to say Probably the planning, in general. So the paperwork takes a long time. You're coordinating with an advisor, you're coordinating with your preceptor, the organization site. So there's a lot of things that you have to get pretty aligned fairly fast to understand what your deliverables are, what you're going to be conducting, how and what that's going to look like. And that will take some back and forth with your advisor, hitting those MPH competencies and your concentration specific, along with what the site is offering, and what the organization needs help with. And like you were saying, it's beneficial for me. It's also beneficial for the organization themselves. So it's kind of finding that sweet spot where, the MPH students benefiting on their side, and then the organization's also benefiting. So I would say whatever time frame anyone's thinking of, go earlier than that. So whenever I started planning fairly early, and it still took a while. It's just what happens going through paperwork and the logistics of things. And I didn't go through the IRB, but I know if people do have to, that's an added step and takes a little bit more of a process. So I would just say, whatever the timeline is in anyone's mind, go like a few weeks earlier than that. If you have the information, put it down, keep it somewhere, so that you can reference back and keep editing the documents. But the logistics side of things and the paperwork, I would say, would probably be the meat of it. And then also just deciding what you want to do and where you want it to happen. So
Yeah, I mean, I think that's exactly right in many ways, actually in all ways, right? Give it more time. Add the extra weeks, you'll always need it. But because there is a conversation that needs to happen, especially in a case like this where it's not an advertised internship project, right? We didn't advertise an internship project and you make the match and then it's ready to go, the content and the experience. You were really kind of figuring out together what was going to work for both of you. And that conversation can take a while. Folks are busy, you need meetings on calendars. And so having that extra time certainly does make that process a little smoother. And then correct, IRB can always add in additional elements and potentially hiccups. We do have a question in the chat. Oh yes, thank you, Danielle. Danielle responded about connecting, and we can circle back. And James, I think you'll hear throughout sort of the rest of the conversation bits and pieces that will also address your question. So the next one we have for you is, can you describe any unique or favorite experiences you had during your experience? So kind of those standout moments for you. We'd love to hear about that.
yeah, I had a few, but I'll touch on one. And this goes back to one of my deliverables, which was working directly with accreditation documents. First and foremost, very interesting experience in getting to review 100+ pages of accreditation report, looking at compliance, non-compliance, different domains, what the accreditation or accrediting body looks at. I mean, it's so specific. And when you get into the nitty-gritty of it, I mean, Campus Health did an amazing job on their last accreditation cycle, and they gained the 3 years, which is the max you can get in between. But obviously every place isn't going to be 100% compliant. So there were some things that I focused on, but being able to review the document and being trusted in that, and going through what is for some people kind of vulnerable. And, that's, Campus Health is a large part of the campus, University of Arizona, and Dr. Slavsky, lucky, and I was blessed to be able to work with this, and, lucky enough was able to review these and go over them with him. But I think that just being trusted in the accreditation report, I mean, I'm not sure if that's a very unique experience, but it was very unique for me. And just getting to see the behind the scenes look. So a lot of people don't see this. It's typically just the administrative side, and they review it and then move forward from there. But just as a student, gaining that exposure and knowing that I may potentially in the future have to look at documents like this and understand them and review them and create, program evaluation plans and some sort of SMART goals to, address those. So that was a pretty unique experience for me.
I mean, you're almost guaranteed at some point in your career, probably very early, to have to do these things. But I really like that you focused on that relational piece of trust. So the activities that you're doing sound very meaningful for you. And again, maybe not so much for somebody who's interested in community outreach, right? Although the elements of reviewing a document and being able to sort of pick it apart in a really professional way and understand exactly the things that were going well, maybe need improvement. But that relational piece of trust building, I think, is so powerful, because it's something that now that you've had that experience, you know what that feels like. And you know how excited and how positive the experience can be when you have that. And so I think that's really important for folks to hear, that as you move forward in your career, you're going to have this knowledge of knowing what it's like to be in a space that values who you are and what you're bringing to the table. And I think that's what is also really important about internships, right? Is students get to practice that. I think you were really benefited by being in a situation that was positive. Other students might not have as positive an experience, but that experience still gives them information that's powerful for their career. Maybe it's not being as trusted as they would hope they are. I can tell you 99% of our sites, the evaluations that they give of the students are wonderful, and the evaluations the students give of them are wonderful. So I know that trust is happening at other places, but we don't often hear about that. And so I really like that you focus on that. That relational piece is so important. For you, in your experience, your AP experience, did you have any moments where you needed to pivot? Like something wasn't working right, or something went fabulously wrong, or any moments that you had to really kind of change direction or do something you weren't expecting to have to do?
I wouldn't say not necessarily a pivot for the work I was doing, but rather helping and assisting in other places. So it wasn't necessarily like something went catastrophically wrong with, or something happened with the projects I was conducting, but rather if there were spots at Campus Health where I was able to plug in, and maybe that kind of, let me explain this. During my QI assessment, I was working with the immunization manager, and I was working closely with her on numbers and kind of what it would look like to boost immunizations. That plan kind of pivoted into a marketing effort, which then kind of pivoted into working with the lead graphic designer and the communications manager. So alongside of the immunizations manager, to create a flyer for Campus Health for their travel clinic. So not necessarily something that was pivoted from anything that went wrong, but rather kind of a beneficial thing. So looking at it as this is going to be a great marketing piece for Campus Health to help hopefully boost immunizations in their travel clinic. It was right around the time of spring break. And then we also kind of discussed how to utilize it for summer break too, when people are traveling. So that was a fun piece that was kind of a pivot from my original project, but still tied in great, and still I could use in my QI plan to say, this is a part of the studying and doing section of the Plan Do Study Act. And then how do we see an uptake, hopefully, with this marketing effort?
Yeah, so it was like a little happy little snowball.
Yes.
And so it wasn't that anything went wrong over here. It's just you had a new thing kind of grow. And I am assuming, and correct me if I'm wrong, but immunization is also probably part of the accreditation. Is it a measurement for the accreditation?
Yes, it's all
connected.
interconnected some way, somehow.
It's like Bob Ross, his happy little tree. It's like a happy little snowball over there that kind of gets you going and keeps you moving. And that's those can be really fun pivots. And I feel like many times, many of our students, I ask that question, and the answer is yes, something went wrong, because that's par for the course, I think, in life and in experiences like this. But I love that you're able to say, well, it wasn't a pivot from something wrong, but it just kind of took me in a new direction. And I think that's the beauty of internship experiences. When you are at a site that you feel trusted and you feel valued, they can say, okay, here's what we need to do. Can you help us with this? And then you're able to branch off and do something that allows you to practice skills. I know you took a marketing class. So were you able to use some of those skills in what you did?
Yes, yeah, and it was great because I was kind of that liaison between the three professionals, and then just gaining experience from them of, from the communications manager side, okay, like what is the verbiage going to look like? How is this going to relate to the students? How do we not make it too wordy? How do we make it, have enough information? And then on the immunization side, working with the immunization manager to really focus in on what needs to be on there, what are the important points, and then graphic design, how do we make it appealing? How do we make it
Yeah.
students are gonna, scan the QR code and actually utilize what we're doing. So the marketing course piece for sure helped and really gave me the tools to be in between each of the professionals, but then also kind of share what I thought and put it together and kind of get it rolling. And that ties back to curriculum piece too.
Yeah. Yeah. So my next question to sort of bridge right off that is, how do you think you were able to either sort of practice or emphasize the curriculum in your experience, your curriculum content?
Yeah, I love this question because I am always looking for a tie back, and was really trying throughout my MPH. Every class that I was taking, I was also doing I had 2 jobs on top of that, so really, like, trying to apply, although it wasn't necessarily in a public health setting, I was trying to utilize what I was learning, in those roles so that I could actually gain experience, and then the internship was the cherry on top. That's where you get most of your exposure to what you're learning in the class and actually applying it hands-on. So, 2 of the classes that I wanted to focus on were the healthcare quality and safety, which really tied into the quality improvement efforts. And I used essentially the PDSA framework straight from that class. And we had countless different QI frameworks to use during that class as well. So I utilized that tool. And then also the healthcare administration class that really gave me a baseline for, and it's my emphasis is healthcare administration, health services administration. So really strengthened my knowledge in healthcare systems and overall operations, and just general knowledge in the healthcare setting. So both of those really provided me with kind of the support I needed and the tools to utilize, and were both very relevant in my time at Campus Health.
Yeah, that's fantastic. It's always, I think it's pretty common. Students, they self-select into their APEs. So they're selecting things they're passionate about just as they self-selected which concentration they were going to pursue. So it's usually a really nice marriage of the two. But I think some students tie it back a little bit easier than others in terms of the content that they're using. And it seems like yours were really well aligned with your curriculum and getting the experience in the field and really building your professional portfolio of things that you're able to have practiced, and that just solidifies it with you in your brain too. And it's like you did this thing, you learned this thing, and now you practiced it. And it's called an applied practice experience. So we love when students are able to actually get a chance to practice what they're doing. Can you talk about some additional ways? I know you talked about the power of networking to get into this space, but can you talk about maybe some other ways you networked while in your APE?
Yeah, I think that this is a really important question, and I obviously was harping on the fact of networking at the beginning of this, but I had mentioned that I have been networking since probably the beginning of my undergraduate career, and I don't ever think it's too early or too late. I mean, wherever you are in your career path and career journey, it is the perfect time, whether that be friends, family, mentors, faculty, staff, anyone that you know is going to be useful in your network at some point, whether it's now or down the line. So throughout my internship, I utilized LinkedIn, and I didn't just find people and connect with them. I made sure to have that initial connection and relationship face to face and in person. I know obviously some people have internships online, so just creating kind of that connection naturally, and then finding those people on LinkedIn or any of those other sites to stay connected. And just sometimes I wasn't working with people directly necessarily, but would introduce myself or just, let them know what I was working on at Campus Health, just so they knew who I was and kind of what my background was. And, not necessarily like taking, I was really taking the initiative, but sometimes it happens naturally. Sometimes you just create connections and you might not even know. So just being conscious during the internship experience to um, utilize the players that are there. and the staff and whoever is working with you. And then if you feel comfortable, to branch out and meet new people and, kind of understand what they're doing and staying in connection that way.
Yeah, I think one point that you made that I would like to emphasize is it isn't just that initial connection, it's the continuity of the connection. So you make the connection and then you connect on LinkedIn. So now you're building a relationship with them. And then, right, the power of LinkedIn is it's a web. So now you can see when they post and their connections, and then hopefully start to figure out the different ways that you can go with that. And I think that's something sometimes we don't do enough of. We make a connection at a conference and maybe we exchange a business card and then we leave it in the bottom of our bag and we don't follow through on it. And so I think there's that's really a skill that seems like you have, and it sounds like you've been practicing it for a long time. But I also want to thank you for what you shared about wherever you are right now. It's never too early, it's never too late. So even if you're somebody on the call or somebody who listens in later and you're a senior in your undergrad career, it's not too late. You're a second-year MPH student, haven't found your internship yet, it's not too late. So there's ways to continue building that, but it is a skill that you have to kind of hone to really benefit the most from it. And it does take some stepping outside your comfort zone. I think for everyone, unless you're a 100% true extrovert, and then by all means, we need those people in our lives, right? But it does take skill to practice that. And so it sounds like you've been doing it, but you're not forgetting the importance of continuing that development in that relationship. And so I think that I'm thankful that you emphasize that, because I really think that there's power there. How do you think for you, and I'm really excited to hear this answer, because I've been working with you for a number of years now, and so I don't know yet. But how do you think this experience is going to help you on the next step? So what is next for Lauren in the career path?
Yeah, I think that this is a great question. And thinking about it, typically I don't have it all set out straight, and most people typically don't. But what I gained from this internship experience and healthcare operations, compliance, evaluation, quality improvement. I mean, these are all tools that I enjoyed working with and knew that I loved during my internship. And, some of the skills that I built were, looking at project planning and communication and, interdisciplinary work and working with different departments at Campus Health. I found the love and I knew I had it, but this is what my next step's going to be is, really solidifying my own internal desire to improve systems. That was, such a big thing for me that I learned throughout my internship, and also making care more efficient and accessible, and like looking at a community as a whole, so like our student population, and seeing, okay, well, how are we going to boost these efforts, or how are we going to ensure that we maintain compliance? So essentially my goal moving forward is to continue working in the healthcare administration field, and drive positive change, but not only change, but lasting change. So seeing how, my presence and what I have and what I've gone through in school can help drive that positive, long-lasting change in organizations. And I just have a love for the management and administration side, so I'm excited to see where that takes me. In my current role, I'm doing program managing work at Canyon Ranch. And I found a love for that too, really being able to look at a lot of things, kind of compartmentalize and ensure that everything's being done efficiently, operationally, well. So moving forward, I know that I have a lot of things in my toolbox. It's just, finding where I land and then utilizing those to the best of my ability.
Yeah, and I think what I love so much about it is for you. So internships do one of two things for most people, right? They either confirm your path and help you advance on that path, or they tell you informationally, experientially, we want to tweak this a little bit, whether it's a new path or there's a slightly varied path. And for you, clearly, this work and this experience has said, oh, Lauren, you're in the right space, you're doing the right thing, and systems is where it's supposed to be. And the beauty of it, HSA as a concentration, is it doesn't have to be a healthcare setting. It can be. There's everywhere is quality improvement. Every organization needs quality improvement. For you, obviously, it's healthcare is the passion. And so it might mean a hospital system, that might mean a campus health system, that might mean an organization like Canyon Ranch. It can mean a lot of different things. So I am super excited to get the email of like where the next step is for Lauren down the road. But it's really important. I think that's why our accrediting body requires experiences, right? Because it's good to confirm or clarify your path along the way. And so for you, you had a confirmation, and I love it. I love it for you. I'd love to take a few minutes now to open it up to the audience for questions. I still have more questions. There's still more learning to do from Lauren, but I'd love to take a break and see if the audience has any questions. Again, you can raise your hand and we can call on you, or you can pop it in the chat. I'll give folks just a couple minutes there.
Hey, Kim, this is David. I just want to say thank you again to Lauren. She got kind of, a chance to touch on a bunch of different things here at Campus Health, and you heard about that in the presentation. But Lauren, I thought when Kim asked you about the pivot, I thought you were going to talk about the all staff meeting when you were when you were doing the survey. So one of the things that we did shortly after Lauren started with us is we had a continuing education week. And one of the things that we kind of agreed on is kind of thinking about topics for the following round for next year. And we just wanted to hear from staff in terms of what topics would resonate for CEs and CMEs. And Lauren was instrumental in that too, and put a survey together. And long story short, we had actually an all staff meeting where everybody came together, and we actually had staged a mock drill. So we actually had a mock code during that all staff meeting while Lauren was implementing the survey. So that was kind of a fun moment. And it was, I guess, I thought you were going to say that for the pivot, Lauren. So I thought I'd throw that out there.
Let me note that I did not know this was coming. I thought Dr. Slavsky actually was having a medical emergency. I was like, I don't know who's going to help, but I'll just stand here and watch because my survey is being deployed.
You're the administrator here. You're not the healthcare provider. Somebody else has to jump in.
She's like, I'm just administering the survey here. So I think we got everybody's attention for the most part. But yeah, just kind of another example. I know Lauren was talking about the accreditation standards, and obviously drills are a big part of that too, in addition to all the other sections. But that was a kind of a fun moment. And, you got to be ready for everything, right?
Yeah, I think that also touches upon, people think of internships as this very like serious, obviously it's a very professional setting, but fun things happen and they're so unexpected. And what a fun, in the moment, I really thought Dr. Slasky was having a medical emergency, but things just happen organically and you just get to meet people and you build this network. And it was definitely, that was a pivot moment. We can share it now. But yes, yeah, it was a fun time, and just being able to connect with everyone.
I'm glad it was a mock moment and that you didn't answer that question by saying my preceptor had a heart attack during a meeting. I don't think that's the kind of pivot we want for students. So well, thank you so much, David. I'm glad you jumped in and shared the fun moments too that happened there, and also for supporting our students at Campus Health. Not the first time we've seen you as a preceptor, so we certainly
it's been great. A lot of great years of working together on that. But yeah, Lauren, from QI to accreditation to immunization, marketing, continuing ed. I think she got a really good cross section of some of the administrative functions and some of the really kind of core clinical functions as well. So we really enjoyed having her.
Excellent. Well, we're glad you had her as well. Certainly it sounds like it's been an amazing experience. Okay, so I don't see any questions in the chat, so I'm gonna ask my next one, which is, if there is, and this might be a no question, this might be there isn't anything, but is there anything you feel like throughout this experience from seeking, planning, and doing that you would have done differently?
Good question. Truthfully, no. And reflecting on it too, I realized how lucky I was to have established a connection, gotten into the internship fairly seamlessly, got to do what I love. Truthfully, it was like win-win scenario. And I know that it's not always like that. So I was really lucky that everything aligned for me perfectly, and really gave me a good blueprint, for what I want to do for the rest of, my career journey. So sorry, it's not a
Yeah.
very fun
No,
answer, but
it's great. But one thing I want to emphasize, and I feel like students don't often say this when they answer that question or when I talk to them about it, things align because you helped them get that way, right? So you didn't just send an email and then things kind of perfect. You did the hard work. You did the hard work to start building connections early. You did the hard work of the plan. You did the hard work at the site. So I love for you that it all worked out really well and you wouldn't have done anything differently. But that was you, Lauren, too. So like, try to remember that for yourself, that like, it's not the universe doing it for you. You helped the universe along. And I think that there's real strength in that for our students. So well done in that respect. So kind of to bridge off that question a little bit is, what did you learn about yourself during this experience?
I learned a lot. I would say a lot of different aspects, both personally and professionally. This really solidified what I want to do in the future, and I probably wouldn't have gained that if I didn't have an applied practice experience. Wasn't placed where I was throughout the semester, and focusing on what I wanted to get out of it. But for me personally, I know that I love administration and learned that pretty clearly about myself. Like I had an interest, yes, but having Dr. Slavsky as my preceptor and seeing what he does and the operations and how campus health really seamlessly delivers care was instrumental for me in seeing what a full functioning, healthy healthcare system looks like. So that was a funny way to put it. But it really solidified me the love of administration. And also another thing I want to touch on, and this is something that took me a little time to get used to, is that lasting change doesn't happen overnight. So the documentation that I was implementing at Campus Health and that I gave Dr. Slefsey to share wasn't gonna be a thing that was, we just snap our fingers and everything's great and we're 100% compliance, rate, and QI is working perfectly and immunizations are booming. Like it's gonna take time. So I think that that's something that I learned about myself, is that meaningful public health change is long lasting, and you put in the work so that you're able to follow those guidelines and that documentation and the rules, whatever it may be. But I learned that, and yes, I had known, but really being in the internship experience, it made it pretty clear to me, because I was like, oh, well, there's only a few projects that I really saw the fruits from. Knowing that documentation is going to take a long time and their next accreditation cycle is not for another 2 years or 3 years in this case. So just learning about myself that, to take it slow, to give myself grace throughout the process, knowing that things don't just happen overnight. I mean, I knew that, but knowing that, my work was going to be meaningful and long lasting, it took me a little bit of kind of a learning curve to get to that point. So I did learn that about myself, and knowing that sometimes I just, you want that quick output, that quick response, but it takes time.
Yeah, instant gratification is often not a thing in public health, right? There are certain areas of public health that are working downstream and get to see the fruits of their labor immediately. But most public health folks live upstream, right? And that's the point. And so the work that you're doing, especially in administration, is helping to set things up so into 3, even 4, 5, and 6 years from now, they'll see the benefits and the fruit of your labor. But yes, if you're looking for the personal value in your work, it's not going to be right in front of you often. It will be in the relationships you build and the quality of the work that you do and the experience of that. That's where sort of it'll happen. So yes, I can appreciate that. And sometimes it's that patience is a virtue. You really have to build that in. We have a great question in the chat, which is, how did you balance your work with academics? So your work, your internship work, and your classwork.
Yes, definitely was a learning curve. And I had been working two jobs in undergraduate too, on top of course curriculum. One of them was working at Canyon Ranch just as in retail, just as part-time. I would do maybe 2 days a week. It was like 6 hours. So it really wasn't a lot of time that I was plugged away from school. And then I also worked for the University of Arizona track and field team as their head manager. So really looked at operations work with them, but balance. That's the big question, right? Is how do you balance all these things? Big thing for me, and I learned this when I was younger, is time management, understanding the importance of your time and how to allot it. So I use probably 3 different calendars, and people may call me crazy. I have a calendar on my phone, I have a hard copy calendar, I have semester on a page from the University of Arizona that I utilize that had all my due dates. When I got the syllabus, I would write down every single due date, when I should have stuff submitted, when I should have, rough drafts or copies by, so that I had time to review. So my mind was thinking, how do I set myself up for success at the start of the semester so that I'm not falling behind and I have those checks and balances there for myself? So that was a big thing. And then also understanding kind of your level of importance. So school is always number one. I did have other obligations, but they knew that school was number one. And for myself, being able to advocate when I had a presentation or when I had a big project due, I would take time off if, and everyone's work is going to be different, but knowing ahead of time that I needed, um, a specific week to really focus on school. And that goes back to that time management piece, but really focusing on setting myself up for success in the beginning and then keeping those checks and balances along the way with my 3 different calendars. And that's not that's not like a suggestion or recommendation, but that's just what I did. And everyone's, cadence is going to look a little bit different for how their semester goes and how they jot down information. But yeah, time management and then, really try to set myself up at the beginning were the biggest 2 things. But that's a great question.
Yeah, it sounds like what you're saying really is if you build it enough, then things don't feel like they're emergencies. A final due date doesn't feel like an emergency when you've had you 2 drafts. And calendars to remind you that you had 2 drafts. And things don't feel, and so that helps keep the stress level down too, right? Is because you really are knowing all along the way where the upticks are going to be in your work. And thankfully you had the boundaries already set that school is number one, and you had employers and folks who could accommodate that is really special. And I know, just like you said, not everybody has that opportunity, but everybody has the opportunity to set things up so they know what they need to do from semester day one till the end. And so doing that really gives you a little more control, especially when if you have a lot of things you're balancing, you feel out of control. And so that helps to kind of solidify it. So thank you, Denise, for the question. And thank you, Lauren, for that answer. So does anybody else in the audience have any other questions before I ask Lauren sort of our last final question that we like to ask? I really wish the chat function had the 3 dots that somebody was typing, so you would know that someone was typing, but okay, I'm not seeing that. So the last question we have for you is, what is the parting advice, like the strongest, kindest, best parting advice that you would give to MPH students or even prospective students about the APE process? Knowing that you have been sitting on the other side of the screen, what's the last bit of powerful parting advice you would give them?
Yeah, my number one piece of advice would be to be proactive. And I know I was discussing this earlier with the logistics of what the internship entails, but be proactive and don't hesitate to reach out to organizations, put yourself out there. It may feel uncomfortable, but it's worthwhile, I promise. Just for that initial connection, just that initial, conversation with an organization that you may be interested in. I remember I was calling an integrative medicine facility and they were like, we don't do internships and we don't want you. And I was like, that's fine. That was just, another door is going to open down the line. So I was, giving cold calls to places, and this was an undergraduate, but, reaching out to a bunch of different organizations just to see if they had any opportunities. So being proactive, not hesitating to reach out. And then I would say probably my last one is connection to your network and building that as you go, because that's how I landed my internship. And that's, sometimes how the best opportunities arise is through the people that you know. And just start your paperwork early. Even if you think you're too early, you're probably not early enough. It's the logistics, it takes time. You're balancing between the college, your advisor, your internship site, your preceptor. So I know that those were a lot of different pieces, but that's what really helped me. And from being on the other side of this and listening to students and hearing their experiences, and now being able to give my advice, it's just a very valuable experience for myself. Very, very honored.
Yeah, it's really about setting your intentions and then following through and making sure you've built the building blocks so that you have resources to rely on while you're doing this work. And there's again, it's you doing this work to set yourself up for success. And I think that proactivity is all a part of that. So thank you so much for that parting advice. That was really lovely. So this, if no one has any other questions, this ends our formal discussion with Lauren. We do have a few other things we're going to go through. If you can hang tight, talk about the rest of the conference and where you can watch presentations and all that good stuff. But Lauren, I just want to, from the bottom of our hearts, thank you so much. It's really special for us to have students come here, not only for everybody who's in attendance, but we get to learn a lot and share your advice with students as we work with them. And you can better believe that I will be calling on you for extra things as you graduate. You will not escape us. We really, really appreciate your time today. And with that, I'm actually going to pass it right to Vanessa, who's going to give us a little bit of more information about how to view Lauren's presentation and other presentations.
Thank you, Kim. We also want to encourage you to view the APE conference webpage to see this semester's MPH student presentations. They have all worked incredibly hard on their projects, and the virtual conference page showcases that. And just so everybody knows, that is our main campus, Phoenix, and online MPH students that you can take a look there. We will post this link in the chat here to the presentation viewing page, so make sure you take a look at the chat. Presentations will be viewable in an on-demand format until August 15th. We encourage you to watch as many presentations as you can during the viewing period. For each presentation you watch, we ask that you fill out the presentation feedback form linked on the presentation viewing webpage. And now you are going to hear from Danielle.
Thank you everyone for attending today, and thanks to our presenter for this discussion. We would like to thank all of our wonderful applied practice experience sites and preceptors with whom we work to improve public health. There's a link to the feedback form in the live chat here, and we would appreciate if you could please take a few moments to complete the form to help us improve this event in the future. And we have come to the end of our live event, and we sincerely appreciate everyone joining us this afternoon. And a big thank you and shout out to Lauren. You're so amazing. And we hope you enjoy watching the other students' recorded presentations and Lauren's, and we wish you a fantastic day. Great job, Lauren.
Thank you so much.
Should we stop recording?
Perfect. And I put everyone,